Yeah.
You ready?
Yeah, go.
And we're back. And now we just discussed hip clicks, so now we're going to move on to gluteal folds. And what gluteal folds are is they're asymmetric gluteal creases, and they may be a sign of hip dysplasia, which also, if you hear a bunch of hip clicks, that's also a sign of hip dysplasia. And surfactant. Surfactant coats the alveoli to help prevent the collapse and prevent respiratory distress. So what that is, it's in your lungs. There's a small space, and that's surfactant there to make sure everything, no rubbing. We got a good smooth, you know. All right, and then 3 shunts. There's 3 shunts in a baby's life. We got the ductus venosus, which it diverts blood away from the liver. And as soon as you cut the cord, as the baby comes out, the ductus venosus is going to close. And it's going to permanently be closed after about 1 week. And then we've also got the ductus arteriosus. And it's going to it's going to divert blood away from the pulmonary artery in the aorta. And it functionally closes at 15 hours, and it's going to functionally close at 3 weeks. And then last but not least, we got the Formenot valve, and it diverts blood away from the right atrium, and it's going to take it to the left atrium rather than the lungs. And it functionally closes in 2 hours of life and permanently closes in 3 months. And then we got a few methods a baby can lose its heat. We've got evaporation, and what we want to make sure to do is we want to make sure that the skin's good and dry so he's not losing any heat through there. And then conduction. Conduction is when you sitting it on a cold surface, the heat from the table is going to conduct up. So you want to make sure that you put a blanket down so the baby's not directly on the cold surface. And then convection, similar to a convection oven, the air circulating in the room. If it's colder than a certain temperature, that's going to bring the baby's temperature down. So you want to make sure that the room is at a good temperature. And radiation, we want to keep the baby away from a cold wall. You don't want to tuck him up to it because that cold wall is just going to radiate the cold air right off to him, and that's going to drop our baby's temperature as well. And we want to make sure that we encourage the mother to breastfeed because breast milk has more antibodies than formula, and as I said, it's preferred over formula.
Does formula have any antibodies at all?
Formula does not, unfortunately.
Okay. Just checking.
Okay. And then, as we're speaking about breast milk, we want to speak on breast engorgement, which breast engorgement is, it's an enlarged breast from production of breast milk. And if the mother's not wanting to breastfeed and she wants to try and avoid breast engorgement, we're going to instruct her not to pump, and so she's not overproducing here. And then we're going to speak a little bit on the premature baby. The premature baby is going to have a clear, transparent skin with a lot of vernix, and we want to take a heavier assessment on the premature baby. And in the genitalia of a boy, the genitalia are going to be non-distended. They're going to be more tucked up in there. They haven't descended yet. And then and girls, our majors aren't going to cover the minors. And then on the post-term baby, the skin is thin and loose, and it's going the genitalia in a man are going to have more rugae, as so premature. And then on a female, we're going to have a very enlarged vagina. The majors are going to really take over the minors there. And then on a posture, you're probably wondering what's the posture? What should a posture be for a baby? He should kind of be all tucked up like this, kind of like a frog. The square window. What we're checking for here is the square window. It's just you're gonna bend over your wrist and make sure that you're not touching. If you do bend his wrist and his fingers do touch his arm, then that's gonna be a sign of a premature baby. And then the arm recoil. When babies come out, their arms are normally tucked up like so. And what an arm recoil does is we're just going to pull it away, and we're going to make sure that it retracts right back. And if it doesn't, that could be a sign of premature baby. And then we got our popliteal angle. That's the popliteal angle. That's going to be bending at the knees. And we want to make sure that there's a good angle because if it touches the baby, it's just going to be all flopping in a premature baby. We don't want that. And then we're going to also test for the scarf sign. The scarf sign is what you do is you bring it to the midline of the chest. And in a good healthy newborn baby, the elbow is not going to cross the midline. But in a premature baby, it could come way over your midline of your chest, and we don't want that. And then we also got your heel to ear. What the heel to ear does, and obviously, in a good normal human being, you can't touch your heel to your ear. That's just not possible. But if your baby does, That's a sign of premature because he's got a lack of muscle tone in there. And then also, last but not least, I want to speak a little bit about the Ballard scale. The Ballard scale, it's a scale from -1 to 5. We're just going to test our skin, our lango, which is fine hairs on the baby, our plantar surface, our heel surface, and then we're going to check the breast, the eyes, and the ears. We're going to test the genitalia of the man and also the genitalia of the female. Okay, actually we got a couple more things I just want to hit on right here. In a mature baby, the nipples come out from the body, and then the premature nipples don't stick out. So it's kind of like an innie. Your nipples are innie. That's premature. And the chest and head, the chest and head measurements. How could I almost forget about that? What we're going to do is we're going to measure his chest at the brow line, and you can get a good circumference, and your head circumference usually is going to typically match your chest circumference. And we're also going to want to test the ear to make sure once you bend it up, it pops right back. You don't want it to bend it up, and you don't want to bend it up and it just hang out. It's like a dog. You want it to flip right back. And then we're going to look at our baby, and we're going to make sure that we got our eyes right here lined up with our ears. We're going to make sure everything's all right. 'Cause, in Down syndrome babies, they usually have a lower set eyes, so we want to make that's a good indicator of Down syndrome. And I think we got a good, healthy baby here. I think he's going to do well in life. He's going to thrive. And thanks for watching. You have a good one.
Hold on, what, on the app scar, what was the highest that they can score, and what do they normally count it off on?
And on our APGAR score, one thing I forgot to mention, they usually score about a 9 out of 10, and the one thing they mainly count off for is cyanosis, which is lack of color. So, Chuck says bye. Give us a high grade. We thank you. Good night.